The COVID-19 task force sitting in Kampala has implored Ugandans to embrace vaccines and get booster shots for more effective control of the pandemic. The Minister of Health is racing against time to ensure the remaining vaccines are consumed before the expiry date. A status report presented in the meeting indicated a marked fall in COVID-19 cases, signalling the containment of the pandemic.
I want to thank you for your efforts, because we are where we are because of your efforts. I want to thank the Minister of Health for the resilience and the guidance you have given us and the President, and all of you honorable colleagues. I want us, after COVID, to focus on other sicknesses, on other diseases like malaria. After COVID, we need to refocus our energy and the efforts towards that and fight it the way we have fought COVID.
Other salient issues discussed included whether or not to close the COVID-19 testing laboratory at Entebbe International Airport. It was resolved that this laboratory be closed since testing at the airport before departure was no longer a requirement.
I want to thank all of you for the efforts in controlling the COVID-19 pandemic. Today, Right Honorable Prime Minister, we are not doing so badly because of the efforts that we have put in. And the cases are not rising exponentially. At least the positivity rate has remained low. In spite of the fact that it started rising, it seems to be coming down. We shall hear from the incident commander. I want to thank you for your efforts. I have heard, I have followed you wherever you go. You talk about vaccination. Thank you very much. And I want to...
The meeting also agreed that there is need for increased sensitization and engagement with the population about COVID-19.
The answer to this is continuous sensitization so that our people are mobilized to go and get vaccinated.
The reason why we should increase vaccination is not only preventing illnesses, but also trying to prevent other variants coming on so that we do not go back into where we were. And part of the problem we are having globally, not only in Uganda, the amount of tests we are doing is not optimal.
The report about money collected from the public to support COVID-19 management was deferred. The Minister for Finance, Matia Kasaija, said a comprehensive report will be provided at a later date. Kasaija also guided on what business should be done to recover from COVID-19 effects.
The impression I've seen is that we must be back where we were before. We shall get there, but we shall get there progressively. You know, it's like when you fall sick, they take you to hospital. Then you recover, but you don't recover fully. So there is a period of recapitulation or something like that. You doctors, yes, please. For the small businesses, there is money that is in the bank waiting for them. For the medium and the large ones, there is money in Uganda Development Bank and other financial institutions. Farmers, there is a fund for you. PDM now also has come.
Much as the order to put on masks was lifted, the task force advised that public should continue putting them on until such a time when the country achieves the recommended 70% of people vaccinated.
Putting on masks is healthy. It has helped us to control flu. When you look around, people don't have flu. And it also protects us. But as you have said, the population dumped the masks long ago. It is us, the working class, who have the masks. But we are also in the age brackets that is the dangerous age brackets. We need to keep ourselves healthy. Try as much as possible to keep on your masks, and unless you are, of course, outside, and get boosted. We have booster doses for all of you. You can access it from KCCA near here, Makerere University Hospital, any hospital, whether Mulago, public, private, wherever you want to go.
Cases of side effects of COVID-19 vaccination and other claims that the vaccines were brought to control population growth have greatly affected vaccination uptake in the country.